Hi, and welcome back. In Module 4, we shift from recognition to intervention. Occupational therapy supports sleep participation by addressing routines, environmental factors, regulation, and caregiver collaboration. In this module, we will walk through practical, evidence informed strategies that you can apply within your pediatric setting. As with the previous modules, this content is intended for professional learning. Occupational therapists support sleep through routines, environments, and participation. When diagnostic concerns are present, we collaborate with medical providers. Clinical decisions should always be made in partnership with the family and the interdisciplinary team. By the end of this module, you will be able to identify occupational therapy supports that promote pediatric sleep participation. You will also be able to describe sleep intervention approaches supported by research for children with autism spectrum disorder. And finally, you will apply routine-based, environmental, and caregiver-based supports within pediatric practice. This module is designed to help you move from understanding sleep challenges to confidently addressing them within our scope of practice. Let's begin with the OT's role in sleep intervention. We support performance patterns by helping children and families build consistent bedtime routines. We look at the environment and make adjustments that promote sleep readiness. We also address regulation, especially when sensory or emotional factors are impacting bedtime. And we work closely with caregivers so that changes feel realistic and sustainable. Sleep intervention is not one single fix. It is layered and individualized, and it always connects back to the child's participation. Intervention begins with the foundations that shape sleep readiness. Sleep hygiene is often where we start. This includes maintaining a consistent bedtime and wake time, establishing a predictable bedtime routine that signals the transition to sleep, limiting evening screen exposure, reducing stimulating activities before bed, and then encouraging daytime movement and natural light. These foundational supports are straightforward, but consistency can be challenging for the family. And our role is to help these families make small, realistic adjustments that improve sleep readiness and support participation throughout the day. From there, we look more closely at bedtime routine supports in practice. This is where we review the child's current bedtime routine. We ask what is already working and where are the breakdowns. From there, we help the family build a simple and predictable sequence that the child can follow each night. If timing needs adjustment, the bedtime can be shifted gradually rather than making any abrupt changes. We can also add calming activities that support regulation right before bedtime. And it is important that routines remain consistent across caregivers whenever possible. When these routines are predictable and aligned across adults, children are more likely to feel secure and be ready for sleep. In addition to routines, the sleep environment plays a significant role in sleep readiness. Environmental supports can make a meaningful difference. And this includes dimming the lights in the evening to support the body's natural sleep signal, reducing noise when possible, keeping the room cool and comfortable, using the bed primarily for sleep so it becomes associated only with sleep, and then reducing clutter or visual distractions that may increase stimulation. These adjustments may seem small, but they shape the context in which sleep occurs. And when we modify the environment, we often support regulation without requiring additional effort from the child. In some cases, regulation becomes the central focus. When regulation is part of the picture, we take a closer look at how the evening is structured. Research shows that having a consistent evening routine is important and that predictability can help the body begin to settle and prepare for sleep. Calming activities can be built into that routine. What feels calming will look different for each child. We also consider the sensory environment in the evening. Lighting, noise, and activity level can all influence sleep readiness. When we reduce overstimulation, this can support the transition from alert to calm. And as with all occupational therapy supports, these approaches should be individualized and adjusted based on the child's response. When working with children with autism spectrum disorder, sleep often requires a more structured approach. In this population, the research consistently points towards behavioral sleep education and structured bedtime routines as core supports. Predictability tends to be especially helpful, and many children with autism spectrum disorder respond well to routines that are clear and consistent from night to night. Daytime movement can also support regulation. Supporting regulation during the day often helps set the stage for sleep in the evening. In some situations, targeted technology supports may be appropriate, depending on the child and the family context. And ongoing monitoring is important. As patterns become clearer, supports can be adjusted. Like everything we've discussed, these approaches should be individualized and developed in collaboration with the family. When we bring this into practice, the process becomes more collaborative and gradual. The first step is to assess sleep participation, such as how is sleep impacting daily routines and what patterns are actually showing up. From there, we plan collaboratively with the family. We prioritize routine-based and environmental supports that fit within their context. Afterwards, implementation should be gradual. Introducing 1 or 2 supports at a time allows the family to adjust without becoming overwhelmed. And then we monitor and adjust. Tracking sleep patterns in daytime participation helps us determine what is working and where changes may be needed. Sleep intervention is not static. It evolves with the child and the family over time. Let's briefly revisit the key takeaways from this module. Sleep participation can be supported through routine-based, environmental, and caregiver-based supports. For children with autism spectrum disorder, the research continues to support behavioral sleep education and structured routines. This is when predictability really matters. Interventions should be individualized and they should be introduced gradually within natural routines. And ongoing monitoring helps us understand how sleep is affecting the child's day. When we track patterns over time, we can adjust supports in a thoughtful way. Sleep intervention in occupational therapy is layered, it's collaborative, and it always connects back to the child's participation. The approaches discussed in this module are supported by current pediatric sleep and occupational therapy research. In the next module, we will apply these ideas to clinical presentations. This is where we move from understanding sleep supports to actively using clinical reasoning in practice. Thank you so much for your time and engagement.